Before we move on, a quick reminder, do check out our Sophie Ridge on Sunday podcast. It features the best bits from the show, plus some extra analysis from me and my producer, Matt. Just go to the Sky News app, Spotify or Apple Podcasts to find that. Now, we know that older people are particularly vulnerable to coronavirus and many over 70s are having to isolate at home. We've all heard of the difficult situation being faced by care homes that we were discussing with Grant Shapps earlier as well. And to talk about that a little bit more, we're joined by the former Pensions Minister, Baroness Altmann. Thank you so much for being on the programme.
Morning, Sophie.
Whatever happens next Thursday, it feels as if many older people, many older 70s, are going to be having to stick to this strict social distancing rules or even self-isolate for some months to come. Do you think that's right?
Well, I certainly hope that as we move out of the current emergency phase of lockdown, there won't be some kind of blanket policy to forbid people of any particular age from leaving their own homes or from being part of the community. I think using an age-based criteria would be fundamentally wrong and actually would potentially cost the lives of many people and risks social unrest.
That's interesting. What do you mean by social unrest?
Well, there are so many over 70s who can't bear the thought of having to stay in lockdown a moment longer and have accepted it, obviously, because everyone else has got to do it. But if they're fit and healthy and they need to get out for their own sanity and for their own physical health, then the idea that the government will tell them you are under house arrest while everybody else is free and you're forced into solitary confinement, which of course is often the case. Many older people are on their own and rely on this interaction with other people for their own basic needs of life, then I think that they wouldn't accept it. Certainly lots of them have told me that they would rebel and they would risk going to prison rather than being forced to isolate at home.
It's interesting because as we learn more about this disease and who is most at risk, whether it's, if you're overweight, if you're male, if you're from a BAME background, I just wonder, do you think that it's right that we ask older people as a blanket ban, if it's a healthy woman, for example, age 70, to do something that perhaps we wouldn't ask all men or all those from ethnic minority backgrounds to do? Is that age discrimination?
Of course it's age discrimination. There's no other way to look at it. A healthy 70-year-old is probably less risk to society than an unhealthy 40-year-old in terms of vulnerability to this illness. Of course, the death rates or the number of people, older people dying, are higher than the number of younger people. The number of older people dying of anything is always higher than the number of young people dying. That's why life insurance for a 20 or 30-year-old costs very little, but by the time you reach age 60 or 70, it costs a fortune. That's because the probability of dying as you get older increases, but that's not necessarily an indication that COVID itself is going to strike down a healthy 70-year-old any more than it's going to strike down a healthy 40-year-old unless the 70-year-old has other conditions. And the fact is, we live in a free country, don't we? Most older people would be sensible enough to know when they need to stay at home and also to know when they need to go out. If the government wants to advise people and say, look, if you're more at risk, don't consider going out unless it's vital. That's different from formally mandating that people of a certain age must all be locked up as if they're a homogeneous group, which they're not, and as if their lives don't count in the same way as others. And that is something that I think we absolutely as a society need to get to grips with. This idea that just because someone is old, they're frail, they're vulnerable, and they're not fit or they're not worthy of the same treatment as other age groups is utterly wrong, and I hope that we can get away from that as soon as possible.
I mean, you say there that older people have been treated as if their lives don't count. I guess the government would argue that the opposite is happening, that there is a strong age profile when it comes to COVID-19. You can see it. We've all seen the tables. And what they're trying to do is to protect those people in the older age category.
Well, I'm telling you that protecting them means allowing them to get out and go about their lives as soon as possible for many. And as you said at the beginning, nobody would dream of saying that all non-whites must stay under house arrest, but everyone else can go free.
Okay.
The reality is that more BAME people, sadly, are falling victim to this than others. But somehow it's not okay to discriminate on grounds of gender or obesity or colour of skin, but everybody is saying that let's think about somehow discriminating on the basis of age as if the older people are okay to discriminate against. And it's not correct.
OK, now I'm keen to talk to you a bit as well about care homes. The situation in care homes, one of the real tragedies, I suppose, of the pandemic that we've seen. More than 4,000 deaths in care homes involving coronavirus between the 10th and 24th of April alone. I mean, Sky News has visited care homes where they believe more than half of residents have coronavirus. Have they been abandoned?
They certainly feel abandoned. And what we are seeing is an extension of potentially this ageist attitude. But it's also allied to our system of social care, which is treated as second class relative to healthcare. So the NHS is totemic. And if something is considered to be healthcare, it's somehow sacrosanct and everybody must get it for free at the point of need. If something's considered social care, somehow it's okay to say, you have to pay for all of it yourself, and we're not going to focus on it. We're leaving it to cash-strapped councils. Now, that, in my view, is a false and artificial distinction. Both are about health and both are about care. So we need to integrate the system. And I know the government wants to do this. I know the government has been looking for ways to do this. But what this crisis has done is highlight the way in which the NHS has pushed out the focus on social care, even though those people who are relying on social care, whether it's in a care home or indeed relying on care in their own home, have not received the focus. They have not received the attention. And indeed, you have stories of hospitals discharging people back into care homes, either knowing they have COVID or not having tested for COVID, which has resulted in those people living close by others who are also potentially vulnerable, because that's where our frailest elderly people are living. Also catching the disease. We haven't had the same supply of PPE and testing for care homes. We have focused on hospitals. We focused on freeing up capacity in the NHS. We now have tens of thousands of spare beds across our hospitals across the country. And yet the older people in care homes who could and should be really looked after in a hospital setting have been thrown back into the care system at the mercy of councils and local authorities and a different structure that is not looking after them in the same way as the NHS.
I think you're certainly one of the things I found most extraordinary, the people who've been taken from hospital to care home, either with COVID or without having been tested. That didn't change till mid-April. Ros Altmann, thank you very much for being on the programme today. Thank you.